Hello students. So let me discuss about the hemodynamic monitoring questions and answer. So first question is what is represented by mixed venous O2 saturation in pulmonary artery. So understand the question, what they are asking. What is represented by mixed venous oxygen saturation in pulmonary artery? If we talk about the pulmonary artery, so you know friends that the pulmonary artery, pulmonary artery originates from the right side of the heart, right? So they put a catheter in the pulmonary artery, and by using a part of the catheter they collect a blood sample and send to the lab, and in the lab they check the SpO2, mixed venous oxygen saturation, because in the right side of the heart you know that the venous blood is there, right? So they check the oxygen level in this blood. So they are asking that what it represents. So A option, oxygen supply. B option, oxygen consumption. Oxygen consumption means oxygen demand. C option, both A and B, and D option, none. So students, in SpO2, by using the SpO2 we can identify oxygen supply and also the oxygen consumption or the demand. So the correct answer will be both A and B. So the option C is correct. Next question is what is normal? Question number 2. What is normal SpO2 level? So students, here they are asking about the SpO2 normal level. So A option, it is given 70% to 60%. B option 70% to 75%. C option 65% to 55%, and D option given 80% to 90%. So students, normal SpO2 level is between 70 to 75%. So the correct answer will be B option, that is the correct one. So next question student, question number 3. A patient is having SpO2 level less than 60%. What is indicated in this case? So student, understand the question. Practical, or we can say this is a applied question. So they are asking about SpO2 level less than 60% in a patient case. So what this SpO2 level indicates? So what the options they have given? A option, increased oxygen consumption by tissues. B option, decreased oxygen supply. C option given, increased oxygen supply, and D option both A and B. So students, understand here what they are asking. SpO2 level is less than 60% in the patient sample or in the patient investigation report. So what it indicates? A option, increased oxygen consumption by tissues. So you know friends, SpO2 represents two things. One is oxygen consumption and second is oxygen supply. These two things are represented by SpO2. Also we should talk about the normal SpO2. So normal SpO2 level is between 70 to 75%. So in case of the patient report, SpO2 level is less than 60%. So what they are saying, increased oxygen consumption by tissues in the first option. So if the patient's body tissues are consuming more oxygen, in that case, in the venous blood, oxygen level will be less. So this can be true. B option, decreased oxygen supply. If the patient's tissues are not getting adequate oxygen or adequate oxygen is not supplied, in that condition also in the venous blood oxygen level will be dropped, decreased. So this can also be a true option. Then C, increased oxygen supply. So friends, students, that if the oxygen supply is more, if it is increased, in that situation SpO2 level will not be decreased. So this is wrong. So if we talk about all these options and in the D both A and B, so the correct answer will be D, both A and B are correct in this case. Next question number 4. A patient, again applied question. A patient is having SpO2 level greater than 80%. It indicates, fill in the blank, A option. So A option they have given decreased oxygen consumption. B option, increased oxygen delivery. C option, decreased oxygen delivery. And D option, both A and B. So again student, in this patient report SpO2 level is more greater than 80%. So normal SpO2 level is 70 to 75%. So we need to compare with this. So this is patient case is more than 75%, means greater than 80% it is there. And you know that the SpO2 represent oxygen consumption and the oxygen delivery. So if the decreased oxygen consumption, in that case, yes, there are the chances that SpO2 level will be more. Increased oxygen delivery. So in this case also there will be SpO2 level can be more than 80%. But in the C option, decreased oxygen delivery. So if the oxygen delivery is less to the tissues, if oxygen delivery is less to the tissues, then in the venous blood oxygen level will not be increased, students. So the C option is incorrect. So the correct option is D, both A and B are true. This is the answer of fourth question. Next question. So next, what is normal PCWP? So students, here they are talking about PCWP. PCWP is pulmonary capillary wedge pressure. So normal value of pulmonary capillary wedge pressure they are asking. So A option they have given 2 to 6 mm of Hg. B option they have given 4 to 12 mm of Hg. C option they have given 20 to 30 mm of Hg. And in the D option they have given 10 to 15 mm of Hg. If we talk about the normal values of PCWP, so 2 to 6 mm of Hg is not the correct answer for the PCWP. 2 to 6 mm of Hg is the normal CVP value, students. So normal CVP is 2 to 6 mm of Hg. If we talk about the PCWP, so PCWP is normal value is between 4 to 12 mm of Hg. So this is the correct answer for the PCWP. So the option B is correct in this case.